Okay. With that, I will hand over to Navinda, and thank you everybody for coming, and good morning.
Hello everybody, lovely to see you all on this bright Thursday morning. Okay, so I always kick off the health and wellbeing meetings with an update about our work with public health, of which some of you are very much involved, Sir Michael and Ziggy. So there's a campaign to obviously to promote the COVID-19 boosters as well as the first and second doses, because there's quite a few people in the borough that still haven't received them. But there's also a flu campaign and also immunisations for children. So I'll take it, but I'll deal with the COVID-19 vaccinations first. So we're now, because we're getting into winter soon, there's a bit of a worry about the flu and COVID, and we probably have colleagues and friends and family who've already had sort of flu, and so for our more vulnerable populations, that's going to be because we haven't built up the immunity over the last couple of years. So it's sort of quite important that we, know the information and pass it on if one feels inclined to do so. So the COVID-19 vaccinations are still being delivered across the pharmacies. There are eight across the borough. And today they're happening at the Holloway neighbourhood group. So 3 of our wonderful community centres, the Holloway neighbourhood group, the Light Project International and St Luke's, have been very much involved in this campaign. So the Light Project, I think what I'll do is I'll put details of where some of these boosters and first vaccinations are happening, and I'll just put that in the chat so everybody's got it. Just do this. There we go. So you've got it there. So everything I'm going to read out now is actually there. So people can still have their vaccinations, and at St Luke's particularly, that's still going on all through October. Is that correct, Michael?
That's right. Yeah.
And those vaccinations are for anybody for 18 years and over. And the vaccine is the Moderna and the autumn boosters. And you can walk in or you can make an appointment. Is that right?
Yeah.
Yeah, great. Okay, so I was going to sort of ask for people to have a think about reflections. So Michael, I mean, I'm not going to put you on the spot now, but public health want to continue to work with us as the voluntary sector, and on promotion, and also have some reflective thoughts, because there will be funding available to keep the programme going within the voluntary sector, if that's what we feel is. So do have a think about reflections on how we could promote further, and what kind of things we could do more of or less of, or do things more effectively. So I will follow that up with everybody later. So yes, so we're pushing on with that, and there's a government campaign to try and get childhood immunisations done for young children who have missed their doses or haven't had one or both doses of the MMR vaccine. And so there's a whole plan in place around that, trying to take a whole family approach. So let's say parents go into the GP surgery, and they will be asked to try and get their children immunised if they haven't already. So there's a whole campaign at Public Health around all of the immunisations, including polio, because there's quite a lot of, you may have read this already, but there's traces of the polio virus in water. And particularly, so we're part of the 5 borough system of the North Central London cluster, and it's a priority in all of the 5 NCL boroughs because of the community transfer of polio. So so the activities underway, basically GPs will be writing to families, parents. They'll get a letter from the GP, and then they'll be asked to come in, and I think they get 3 calls or something like that, or 3 mixture of calls and letters. So, and the GPs have been asked to add more capacity to immunise children. And in Islington, there are 21,000 children, and they are prioritising the unvaccinated, and they're working up the age ranges to basically interrupt community transmission. So I'm not going to say very much more than that about the vaccines, but you know, we have developed a really good relationship with public health, and it feels like they're looking to us for ways of improving communications to families, to the community, and those who are underserved by some of our services. So yeah, that's me. Are there any questions or reflections on? No. Okay.
Yeah.
Thank you.
Thank you, Navinda. And as usual, I will be consolidating all of this information and making sure that it's part of the write-up that will be sent to all attendees, but also on our website. So if you do want to refer anyone to this information, that will be easily done. If there are no questions, do we have Reese with us? I can see your profile, but not your face. Reese, if you are with us.
I am. Hello.
There he is. Good morning.
Morning.
Yes, Reese, I've enabled screen sharing. So if you do want to present, please feel free.
Lovely. Thank you.
I will let you introduce yourself, and you've got a good bit of time. So take it away and blow us away.
Lovely stuff. Well, hi everyone. My name is Reese. I'm the Health and Wellbeing Coordinator from Arsenal in the Community. Been in post with Arsenal for coming up to 4 months now. So sort of just really sort of getting my teeth into starting our new health offer. But the point of today's presentation really is to kind of tell you where we want to take our health offer from where it started when I came into post, essentially. So tell you a bit about what we've got going already and what our plans are for the future. So bear with me. We're about 13 slides too far forward. There we go. Okay, hopefully everyone can see that. So so essentially, just to give you a bit of background, so I came into post, like I say, about 3.5–4 months ago, and from what my previous role was actually at Watford Football Club's Community Trust. I live in Hertfordshire. I'm originally from North London, so it's I've got kind of ties to both areas, and our health and wellbeing offer at Watford Football Club was sort of very well developed. We had sort of some quite large scale programs, and I think the ambition from Arsenal was to kind of not follow that model necessarily, but to have some more sort of robust health programs in the community. So when I came in, we had sort of lots of little things going on. We were making some real good impact, but some of the things we weren't so good at was measuring that impact from what I can see, and also allowing ourselves to sort of make programs more permanent and possibly even lead them towards being commissioned by external funders. So at the moment, just kind of for everyone's information, the majority of the funding that Arsenal in the Community kind of use to put on our programs come from the Premier League Charitable Fund. It's not a sort of Arsenal club money as such, although they do fund a few of our posts, and obviously we are based at the stadium as well. And today specifically, I'm going to be talking about our health program. We do have 2 other strands of work that we do, which is social inclusion. Some of you might have seen the award that was given to our social inclusion team for the No More Red campaign just recently. And our other area is education and employability. But today I'm going to specifically talk about health. So as I say, when I came in to post, the offer was a little bit underdeveloped. So the first thing I wanted to do was look at local priorities. Obviously, Islington, Camden, and Hackney were new areas for me, and those are the three key areas that we cover as a community organisation, with our priorities heavily being on Islington and probably Camden as well, but Hackney not so much. We do some work over there in our social inclusion team, but in terms of health, not so much. And actually, having had conversations with public health in Hackney, there's actually quite a good health offer on the ground there in comparison to the other two areas anyway. So sort of this was just some of my initial scoping that I did when I first came into post, looking at kind of the leading causes of death and the leading causes of poor quality of life. So cancer, cardiovascular disease, and respiratory disease were big ones that popped up. And after having some conversations with Spurs Foundation, actually, because their key area is Haringey, there are some potential collaboration points for us in the future as well. But also diabetes and high blood pressure significantly contributing to early death in the Islington borough in particular. And also there is a growing Black and Asian population in the area, which is relevant to the diabetes specifically, as we know that there's a higher prevalence within those communities. Islington also has the highest diagnosed rate of SMI in the whole of London. I think from my experience in working with mental health, I think you can look at this in two ways. You could look at that and say there is a real big issue with severe mental illness in the borough, but also we're quite good at diagnosing it as well, which means that if we can identify it, which we're quite good at, we can actually take action, and other VCS organisations can take action and create programmes based on that. So I see that as a bit of a positive and a negative. What we want to also do is ensure good access to and uptake of preventive interventions. So one of my priorities is to put intervention-based programs on the ground where we have people come in at one point and they leave at another point. So the first example of that is our weight management program, Shape Up, which I'll talk about in a moment. And I want to do that across sort of several different areas, so potentially cancer and potentially pulmonary rehab, but first priority is to make the links with those services and see where the gaps are. And just a note on dementia at the bottom there. And the reason I've included that is because we are doing some work with older adults at the moment. That's probably the focus area for me right now as we speak. And we had a very strong sort of Alzheimer's dementia program linked to Watford Football Club when I was there, and I saw that I didn't run that one, but I saw the positive outcomes from that, and we're potentially looking at something, some sort of reminiscence-based program linked to the club in the future. So projects for problems then. So that sort of identifies what all the issues are that we can sort of get involved with and start to help tackle. And I've just highlighted a couple that we've already started with here. So obesity, weight management was actually one of the reasons that I came into Arsenal. As I said, we had a program called Shape Up, which is a men's specific weight management program that started in 2014 in Hertfordshire. That program has been recommissioned 3 times in Hertfordshire, being delivered by Watford, and it now sees about 800 men a year. It's really high scale, and it actually outperforms some of the more commercial weight management providers, which I won't mention, in the area in terms of 5% body weight outcomes and things like that. We've started that with a pilot here. After having conversations with Watford about the model, we've started a pilot here in Islington and Camden, and those courses started last week and the week before. Really good cohorts, and the idea for me is to gain as much evidence from those programs, those first initial 2 pilot programs, as possible, so that in theory in the future we can look to get that service hopefully picked up, whether that be through public health, whether that be through CCG funding, whether that be through further Premier League funding. That's quite open at the moment, but that is the ambition from us with that program. And we've also started our strength and balance classes, which they are not postural stability classes. They are not Otago chair-based exercise classes. They are sort of a mixture of the two. And we essentially, I've got my PSI qualification. I've delivered these in the past. And what we want to do is have quite an offer for older people that is quite open. We don't really want too much restriction criteria, and actually the sessions have been going for 3 weeks, started really well. Those run at Mildmay Community Centre, and we will be starting another one at the Arsenal Hub very soon as well. That's one that I think we'll probably end up expanding to 3 or 4 classes because it's quite popular. As for Other things that are sort of in line for the future. I have a strong interest in cancer rehab. I spent 3 years working for Macmillan on a cancer rehab program, which was kind of the first of its kind at the time. This was sort of back in 2015. And I know that our directors at Public Health also have a strong interest in cancer as well. And we know that cancer services has been hit quite hard through the pandemic. So as we come out the other end of that, is there a program that we can look to put on the ground? That one needs a bit more thought, and because of the type of clientele we'll be looking to work with. Inactivity programs, hesitant to dive into this one at the moment because there's so much going on in this area. We've got the Get Active specialists locally, we've got the social prescribers, and there are sort of a couple of other organisations doing similar things as well. So we're working with those teams for now rather than reinventing the wheel and doubling up on work that's already going on. And then mental health. So we actually have a separate department within Arsenal in the community that works with Candy on sort of some of the mental health stuff. Those are football sessions at the moment, but that's an area of development for us as well. And in terms of some sort of other ideas that potentially might come later down the line, obviously the football club has quite a strong affiliation to sort of gambling and alcohol addiction in terms of the types of people that come through and are in the stadium every week. And that's something I would like to look into. There are some, when you have gambling sponsors that sponsor the club, there are some political things you have to sort of get around to start when you're starting programs like that. But that's in my mind as well. But my real passion lies in people with long-term conditions of any kind. So my kind of 3 focus areas for our health offer as time goes by, enable people to be more physically active and maintain a healthy weight. Increase awareness of mental health challenges and provide effective interventions, and to maintain or improve quality of life for the elderly or anybody with long-term conditions. So those are kind of the 3 key areas that we'll be focusing on as programs come out of our department. So these were kind of my priorities when I came into post, scoping discussions with the club, the trust and Public Health, who I have quite a good relationship with because the assistant director, Piers, I actually used to work with in Hertfordshire when he was based over there. And after all of those discussions, we're kind of that's kind of the stage we're at now. We've started a couple of programs which we know are working really well. We're starting to collect evidence so that in the future they can be really robust and provide some good outcomes. And that's kind of where we are now. I'm going to ignore that part. One thing that I will say here is this was kind of something that I put together in terms of looking at where do the existing services sit, where do the commercial services sit in comparison to Shape Up, and this is specific to weight management, and this is based on sort of evidence research. And a lot of the stuff that I was looking at is weight loss retention. So when they finish a program, are they keeping the weight off? Are they maintaining that weight loss? And this is just to say that Shape Up we know it's effective from our previous history of results in Hertfordshire. About 65% of people that come through the service lose 5% of their body weight. And actually it's a free service as well, which obviously puts us in a good position in terms of the cost of living crisis and so on. And actually across the board, most of our activities are free, particularly in health at the moment. I think everything we run is free. And this is just some ideas for how we'll scale some of those programs in the future. So keeping it specific to weight management, because that's the one we've started. We look to exceed the initial KPIs, and actually the KPIs from the Premier League. We have our first set of KPIs from the Premier League this year on weight management. And usually from Public Health, historically, it's been for 50% of participants completing the program to lose 5% of their body weight. But as I mentioned earlier, Shape Up has the potential to achieve more like 65%. After that's done, it's a case of then showcasing those results and outcomes in a positive way and in a sort of modern way, and then building trust with the local statutory organisations, CCGs, the local authorities, in order to potentially get this commissioned in the future. This is a bit of a timeline. Now, this timeline's already a little bit up in the air based on me having COVID for 2 weeks when I came into post and a few other bits and pieces, but we are loosely on track. And this kind of just shows where we started. So actually the start point was June. Project 1, which was Shape Up, was started pretty much immediately. So this is the red section here at the top on the right. And then we're also project planning Project 2, which for us is the strength and balance classes. So looking at January, we'll be starting to model Project 3 and then hopefully starting our third major project through the middle of next year. What that is will be based on priorities. I know that the Islington public health strategy is due out anytime now because I was providing feedback on it yesterday. So we will base our decisions in terms of what we put on the ground on local priorities. And this is just kind of to say where our potential funding sources are. So public health, we know that Islington CCG may be an option later down the line. It's not a relationship we've developed just yet. Smaller grants we are open to, although the scale of the work that we want to do doesn't always lend itself to the smaller grants. We are looking to do some sort of quite big scale stuff. We may start small and build from there. And then inbuilt sustainability is something that I'll be looking to do in the future. And that is essentially, can some of our programs not be semi-commercial, but can there be elements to them where they almost semi-sustain themselves? An example of that would be the Shape Up program in Hertfordshire. We ran an event called Step Up every year, where we invited all of the participants down to the stadium, the Watford Stadium, and we did essentially like a challenge running event, but it involved using all the stands in the stadium, running up and down the stands. All of the families of all the guys that had been on the Shape Up courses come along and attend. We do a kids race, and the last one, which was October last year, raised £11,000. So it gives you an idea of the potential with this. So in summary, I'm starting at Arsenal with a relatively blank slate. We have the potential to do lots of different things. Partnerships are important. So if any of the priorities that I've highlighted or any of our areas of interest have kind of piqued your interests, then I'm interested in collaborating with people, having conversations with different services, and seeing where we can help you guys fill some gaps. So at the moment, one thing that I'm doing is trying to contact the pulmonary team at Whittington. I'll give you a small example. The other day we had a lady who was referred to our strength and balance class, but the only reason she was referred there was because the pulmonary team had been asking her to repeatedly go to the Whittington for pulmonary rehab classes, and there was no way she could make it there. And from what I understand, that was the nearest option for her in terms of pulmonary rehab. So those are the kinds of things where we can have conversations with pulmonary rehab teams and say, can we put something on the ground that's a little bit closer to these people, so that if they can't make it to a statutory service, we can at least give them something in the interim until there becomes something available closer to home. So that's just an example of that kind of collaborative working that I'm looking to do. Also, referral pathways are really important for us as well, particularly with weight management. We're looking to engage with dietitians. We're looking to engage with as much primary care as possible. We've started with some really positive relationships with the Caversham group practice in Camden and Mildmay practice in Islington. But really, we want to build those relationships and that network to the same level that we had in Hertfordshire and Harrow with Watford, which was every GP surgery engaged in the service. So that's the aim. And kind of by learning from past mistakes that I've seen in the industry over sort of the last 6-7 years, and sort of capitalize on national priorities, but ahead of trend. So particularly cost of living is one that we're really focused on now. Not one that lends itself to health massively, but we are seeing how we can plug some gaps there. For example, we know that when cost of living crisis hit, or when people experience extreme deprivation, the first thing that often gets dropped is their regular leisure activities that they pay for. So we want to kind of lean on the fact that a lot of our activities are free to kind of solve some of those issues. So yeah, so in summary, that's me. This is kind of a quick timetable of what we've got on the ground right now. So I'll quickly fly through this. We run in partnership with Active Spaces at Islington Council. We're running the family fitness part of the family kitchen session. If you'd like to know more about that, please let me know, or speak to Amber from Islington Council. These are our 2 Shape Up courses that are running currently. One is at the Arsenal Hub, one is in Camden. Those are both full, but we're already taking our waiting list for January. total body workout. So these are 2 online workout sessions that we run. These sort of grew out of the pandemic, and then we sort of realized that, you know, there are a lot of people out there that they like the comfort of being able to exercise behind a screen without being in front of people and having that intimidation factor. So those are going okay, and we would like those to grow even further. We have walking football sessions, 2 of which are mixed, and 1 of which is a new ladies session. Ladies session's only been running 3 weeks, but we've got 17 enrolled, and that's been really popular. Potential there to have sort of friendlies against other charity organisations and things like that. It's quite a nice one, that, especially for people who have maybe played the full game in the past, but they're now limited by a long-term condition or something of that nature. And then we have our 2 strength and balance sessions as well. Watch this space. I'll be recreating this every time we add a new session. Like I say, I'm only 3 months in, but we want to see this provision grow and eventually have a timetable that has sort of upwards of 20+ sessions on it a week. And again, what those are will be based on priority and what's needed locally. So thank you very much. Those are my contact details. Just going to leave those up on the screen just for a second, although I'm sure my email address will be circulated somewhere. I see Charlton nodding, so that's good. And yeah, I will now stop and take questions. Louise, I see you've had your hand up for a little while, so sorry about that.
Hey, hi Reese, that was really good. You mentioned cost of living, which there'll be a presentation around, I think, 11 by Christine and myself around that. The council are running a cost of living campaign across the borough, and I was quite interested. You talked around the kind of physical impact around cost of living, but we're also considering the effect it has on mental health. And I wondered if you're doing anything or you're planning anything around that, or if there's somebody that we should perhaps be speaking to so we can align our messaging.
No, definitely. So I will definitely I can give you the contact from my colleague, Luke Howard. He does the majority of the work in that area and has the links at the moment. But it's one of those where, because that work was already going on when I came into post, we will probably join up on a lot of that stuff. So yeah, I'll definitely link you in with Luke Howard, but keep me in the loop as well, because if it's something that's more on my side, then I'll be the contact.
Perfect. Thank you.
No problem. In fact, I'll pop that in the chat now. If there were any other questions.
I think Sheila.
I just wanted to ask how people access this. Is it only through GPs if they want to go to one of the classes or put themselves on a waiting list? Can they self-refer?
They absolutely can. She has a great question. I definitely should have mentioned that. So yes, GP referral we are accepting at the moment, because a lot of these programs are so new. We haven't embedded the kind of referral pathway yet. We will eventually be on the electronic referral systems. We will eventually have an NHS email account that you can refer directly into, but we accept self-referral across the board for all of our programs. And I personally triage all of the referrals to make sure that they're safe to come onto our programs. So yeah.
Any other questions for Reese? No? Reese, I just want to say genuinely thank you. That was such a fantastic presentation, incredibly thought out. And in 3 months, you have already made such an impact. And I really enjoyed hearing about the scope of what you want to achieve. And the fact that you're coming to networks like this means that at least there's a spirit of awareness, but also perhaps kind of co-production for Islington. With that in mind, you mentioned about a possible aspiration to deal with gambling addiction. I just wanted to let you know that actually housed at Voluntary Action Islington, we have a national charity called Bet No More, who are working specifically for those that are suffering from gambling addiction and raising awareness and a lot of campaigns around that. Definitely happy offline to link you up with a couple of the colleagues that we've got here, because like I say, they're already in the borough, they're based here, and that could be a really fantastic starting point, even if it's just they could perhaps give a bit of guidance or support on the latest, and you could probably have that discussion about what it is that you're trying to achieve, and maybe it can fill some gaps. But I will make a note of that and definitely link you up after this meeting.
Yeah, no, that sounds good, Charles. Thank you.
Any other questions? Forever hold your peace. Okay, thank you, Reese. In that case, I will move to Pretty. If Pretty is still with us. Yes, I can see you. You're right in front of me. Again, you can share your screen if you like. I will hand over and take it away. Thank you.
Good morning all. I hope you can see that. Good morning all. My name is Pretty Ron. I'm the House Director for Maytree. And I kind of contacted Charlton because I felt that where we had Suicide Prevention Month this month, particularly on the 10th of September, it was important that Maytree maybe attended this meeting, and also for us to start to think about creating positive partnerships locally, whether that's in Islington, Haringey, Hackney or Camden. Because I'm very aware that Maytree has been in the borough for a long time. But yeah, I'm wondering if everybody knows about Maytree and the work that we deliver. So just to say that as I'm going to be talking about suicide and it's a sensitive subject, I just wanted to say be kind to yourselves this morning. If there is anything that triggers anything within you, please feel free to email me or contact me afterwards. I'm more than happy to have a conversation. Apologies, I don't know. My presentation is slightly gonna, I'm just going to stop sharing and reshare. Apologies. There we go. I hope that's, apologies guys. Technology issues this morning.
That's okay, Pretty. I'm just relieved that it's not just me that this happens to.
Apologies.
There you go.
There you go, it's back. Just to say, Maytree was founded in 2002 by Michael Knight and Paddy Baisley, who are former Samaritans volunteers. And during their time in 2000, they realised that there was a massive gap in service provisions for those needing more than one-off telephone support or less than a hospitalisation or psychiatric care. So Paddy and Michael formed Maytree. They were quite revolutionary at the time because they recognised that individuals should have a right to whether they choose to have suicidal ideations or to live or to die. So Paddy and Michael created Maytree to kind of give a space to individuals to have an opportunity to talk and discuss how they're feeling and to reduce their ideations. And the name Maytree was inspired because it's a tree which blooms again in spring after winter, hence the name. Just a little bit about suicide statistics, just to say in 2018, there was recorded 6,500 suicides in the UK. And for every suicide, there's an estimated 20 to 30 attempts. And 1 in 4 people generally know someone who has taken their own life or has some kind of suicidal ideations. There have been new statistics that have been released recently, and they demonstrate that suicide numbers have appeared to have gone down to 5,219. But it's important just to recognise that due to the way that statistics are recorded within this field, some of that data comes in a bit later than it should do, mostly due to how coroners may record deaths. And especially during COVID, we know that deaths were perhaps delayed in being recorded up to anywhere from 6 months to a year. But what we have seen is that the trend has gone down, and we know that men are 3 times still more likely than women to die by suicide, and women are more likely to report suicidal thoughts still. And trends amongst men aged 45 to 49 are still high with suicide completions, and women aged 50 to 54 have the highest suicide rates in England and Wales. That's pretty much the reason behind why Maytree was created. Our aims at Maytree are to reduce the numbers of lives lost to suicide, to provide a non-medicalised kind of approach and support systems within the house. So we use a lot of befriending and holistic listening. We have many volunteers who help to deliver our service. And we provide a brief stay of 4 nights to 5 days at Maytree, and those are free stays. And we support individuals to reconnect with others within the house, as well as connect with other services outside of Maytree. And we aim to reduce isolation and build trust amongst our guests at Maytree. Maytree is a national charity, even though it's based in Islington. and it's a unique, as I said, respite residential service. It's the only one in the country. We offer our guests a safe, calm and relaxed environment where they can rest and reflect on any of the distress or any of the issues that they've had within their lives. And we support people, as I said, with a one-off 4 nights and 5-day stay at Finsbury Park. At Maytree, we offer guests the opportunity to talk through their problems, their fears, through our volunteers who have been trained within Maytree. And we always maintain that we're non-judgmental and accepting of any individuals and any of the kind of issues that are presenting for them. It is our mission to reduce the risk of suicide and to help restore hope for those in suicidal crisis. Generally, when an individual comes to Maytree on the first day, they'll be welcomed into the house by a volunteer and introduced to what the next 5 days may look like. At Maytree, our volunteers and our staff provide the breakfast, the lunch, the dinners, so we provide that full respite experience for the guest. And during those next 4 days, they generally have 2 befriending sessions, one in the morning, one in the afternoon. And by day 3, we start to look at self-care plans and what happens when that individual returns within the community. In 2019, I'm using these older statistics because COVID impacted how the house ran, and we did have to close for a period of time. So it wouldn't give you the true figures of how many people we would have in a year. But at the house at the moment, in a year, we can kind of cater for 145 guests a year. Generally, we receive 1,500 calls into service throughout the year, and our referrals come from up and down the country. Just to say, the 1,500 calls we get, if we were unable to give anyone an offer a stay in the house, we will always make sure that we signpost and link them into local services. This is a video, guys. I might send this on because it's quite a long video. And it just kind of gives you an introduction into the house and gives you insight in what the house looks like and how tranquil it is. So it will show you kind of like our whole front room, kitchen, garden and bedrooms, etc. So I'll make sure I share those slides with you. Just to say, to access Maytree, as I said, we're open to the whole of the UK. Referrals we accept from individuals as well as professionals, and they can both call in and leave a message at Maytree, and then we will call individuals back. Individuals are welcome to email us at Maytree or use our website where we have a referral kind of portal as well, where you can kind of put down individuals' information. The only individuals we would not accept or offer stays to are anyone under the age of 18, anyone who is street homeless, anyone who is unable to abstain from drugs or alcohol for a period of 8 weeks. That's just for safety reasons within the house and for the other guests. And anyone who is unable to engage in a befriending process or conversation about how they're feeling. This is just feedback from one of our guests within the house. And I've not been at Maytree for a long period of time. I also, like Reese, have been here for about 4 months at the moment. And something that I found remarkable is what a stay for 5 days at Maytree can do for somebody who's in suicidal kind of crisis, who've had many attempts previously, and who've also experienced adverse childhood experiences. And it's beautiful to see how somebody can come in who may not trust services ordinarily, build up that trust and rapport with our staff and volunteers, and by the 5th day kind of be more willing to engage with community organisations. We also have tons of volunteering opportunities at Maytree, so hence why we're looking to work in partnership to try and make sure that that people within our localities know that we have these opportunities, because volunteers are the backbone of our organisation, really. They are so valued and so necessary in helping us kind of deliver the services here at Maytree. That's our contact information at Maytree. If you have any questions regarding Maytree, I'm more than happy to take them.
Thank you, Pretty.
you.
Are there any questions?
Could I ask one?
Go ahead.
Thank you. Pretty, thank you for that. The volunteering opportunities, we run the volunteer centre here in Islington, but there's other organisations here that also have, work with volunteers. What types of volunteers are you looking for, and what experience do they need to bring?
For us, the volunteering opportunities really would be for the befriending. So that would involve kind of doing the one-to-one work with our guests, as well as supporting us if they're able to with the lunches and the dinners and things like that. And that is pretty much the bulk of that work, because it's done remotely as well as on site. So they support us in kind of assessing some of our guests as well. It'd be preferable if they did have some kind of experience within mental health, or if they've got lived experience too. Yeah, I'd say that would be it really. We provide training as well. So we give about 3 to 4 weeks worth of training in regards to suicide, what that means, how to work with that, active listening, mental health first aid and things like that. And I think for me, I'm generally looking to kind of adapt this model slightly, because we're very accustomed to having counsellors and psychotherapists kind of volunteering their time. But I just kind of feel like we need more community members to help kind of increase our diversity within the house, because I kind of feel that we haven't got that. And we really, really need to let individuals know that this service is available for all communities.
Thank you. I'll connect you with Marta, who's our
Thank you.
volunteer services manager. Yeah.
Thank you.
Okay.
Val?
Hi, Preeti. Hi. I have to say, absolutely fabulous project. I do believe it is well needed within the community. I'm kind of curious, because we're in very, very uncertain times. And I would suggest that there will be a lot more pressure upon individuals within the society at the moment. Mental health will be impacted. And sadly, there will be people who will consider suicide. I'm curious about a couple of things. I'm curious about your referral pathways, because when I looked at the figures, it seems that you're able to pick up about 10%, possibly less, of those who self-refer to you. So I'm curious about that, because I think there will be a pressure of people trying to self-refer to you. I'm also curious about some of the reasons why residents actually thought about, suicide as their way out, and whether there's anything which we can do as a service to deflect them from those ideations. So those, I'm just really curious about the project. I'm curious about the individuals. I'm very mindful that we are in very, very difficult times, and as I say, there will be pressures on individuals, etc. And sadly, some individuals will consider this path. And I think, as I say, absolutely fabulous project, well needed. The other question is, are there other projects similar to yours in the country, or is this a pretty unique project? Sorry, I've thrown you lots of questions, so I hope you can remember, because I've not written them down. So I hope that's okay.
That's okay, Val. I'll try and answer as many of them as I can. Just to say, Maytree still at the moment is a unique service in regards to the respite and the volunteer model we use. I know within mental health services, the equivalent, I guess, statutorily would have been recovery homes, really. And I'm glad to say that it's great to see the rollout of crisis cafes in most boroughs at the moment as well, because that kind of supports some of the work that we do as well. Yes, we're aware that our numbers may go higher in this coming year. Unfortunately, what we're doing at Maytree is trying to create more of a rolling house than what we've had at the moment. Is guests would arrive on a Friday and leave on a Tuesday. So to increase capacity, we're moving to a rolling house, which means we have 24 hours to turn the house around. And that was only due to COVID. We put in certain provision, obviously, to keep the house and the guests safe. But what we're trying to do as well is create those partnerships, Val, to try and increase partnerships to kind of to enable some of those 1,500 people that we may not be able to support within their localities. We're also next year, as part of our 21st year, going to launch a house in Manchester, which means that increases our capacity to another extra 4 beds within the country. So we're excited about that. We are also trying to create partnerships with various digital apps and things like that as well, to create another kind of support pathway for some of our guests as well. Sorry, Val, I think I may have forgotten some of the other parts of your question.
Preeti, I think you've more or less answered most of my questions. I think I was very curious about the kind of referral pathways and the uniqueness of your project. So it's actually good to hear that you're intending to open something up in the north of the country as well. So, but thank you for responding to my questions.
Thank you, Val. And just to add to that, we're also exploring at the moment with Hammersmith and Fulham crisis services, how we can work closer with them as well. So we're going to kind of see how we can adapt some of this model and expand it, really.
Thank you. Are there any other questions for Priti? I would just like to echo that I think what a fantastic service. Thank you so much for coming to this network meeting and for letting us know that the work that you do is incredibly important. And thank you for doing what you do, because as you say, it must be very taxing sometimes just due to the sensitive nature. So thank you for being you.
Thank you, Charlton.
Without further ado then, I think I will pass on. We've got our final agenda item. I've seen we've been joined by Christine and we have Louise with us, and they're going to take us through a cost of living crisis campaign. So over to you both.
Hi everybody. I'm sorry I've got my camera off, but yeah, it's an unfortunate day today where I actually can't put it on. But yeah, thank you for having us here. So we're just going to talk through some of the work that we've been doing. So the council launched a cost of living campaign on the 6th of September. And that was, we chose that day because that was the first day that Liz Truss became Prime Minister, and we wanted to, our kickoff of the campaign was basically writing to her and asking for more support for residents and also businesses as well. But the overall purpose of our campaign, which is very much a visual campaign and signposting campaign, is to support our residents and businesses to make sure that they've got the advice and information available to them that they need. So what we've kind of done is we've put all of the council offers a lot of different services across a lot of, you know, different service areas. So we've kind of put it all under one umbrella and kind of packaged it that way. And we've created like a new like call line. So we've got the number 822 is dedicated to cost of living support, and we've got a dedicated email address here to help. And we've also created a cost of living support section on our website, so to make that information easy to find. So some of our objectives include like demystifying the financial support that is available, because I think often, you know, even people on benefits may know that they're entitled to this benefit, but they're not entitled to that, or somebody who's not on benefits might not realise that there's certain support, that financial support that they are entitled to. And so we want to increase kind of like the awareness around that support, and also promote the importance of seeking help early, rather than leaving things to the last moment when people are in a really bad situation. And we also want to influence national policy change as well. So that's a key part of our campaign. Our main target audiences are existing benefit claimants, because a lot of people on benefits might not be aware of other benefits that they can claim. And some of those people, we actually know from our own databases that they are missing out on these benefits. So we're able to contact them, we're writing to them. So we've got a program of various like mass letters that are going out to certain people that we know are missing out on certain benefits. But we also want to look at residents who are kind of on the brink of not being able to cope because of the cost of living crisis as well, and what financial support we can offer them. And again, sorry, not again, but businesses as well are a key audience for us, because obviously, you know, there's a cost to doing business and it's all got a knock-on effect, and they are one of our key stakeholders in the borough. And then another key to us is people such as yourselves, you know, that we can support you with your initiatives, and that you can help us get that message out about the support, and the one phone number that we've got on the email address. Like if anybody's worried about money, we'll kind of be the channel for that, and we will signpost people to other support if they need it. So the campaign, as I said, it's quite visual, and we're using our own staff members. So we've got Camilla, who's an Access Islington agent. She's one of the people that you would call if that you would speak to if you called 822. We've got Courtney, who works in our resident support scheme. So she's another person that people are likely to speak to, and Patrick, who is part of our income maximisation team. We're going to kind of build on that as we go. So they're the three key people at the moment who are kind of putting a face to the campaign. As I said, we've got a dedicated phone number, email, web pages. We've also got leaflets, posters, social and digital assets as well. We have a lot of mailings that go out via the council, be it rent statements, leaseholder mailings, and we're using the back of these letters to promote the cost of living support in the borough. And hopefully some of you have fed into our cost of living toolkit for VCS partners. I hope you have, and we're at the moment well, I say Louise is organising the distribution of a toolkit and leaflets. So if anybody who's on this call that hasn't asked to receive this, and please get in touch with myself or Louise, and we can provide you with leaflets, and we can provide you with information that you can use on your website, in your social media, like your Twitter. We've got WhatsApp, like voice messages and stuff like that you can use. And we're happy to share that as much as we can, really. So some of the key things that we've done so far, there was obviously, I've mentioned the leaders letter to Liz Trust calling for more support for residents and businesses. We've got a social media campaign running at the moment, posters up around the borough. Our website is updated. We've using our estate notice boards, and we've also got an internal campaign for our staff to support them as well. We've used the back to school campaign that we do to piggyback off that, some of the information for that can support parents with the cost of living. We have a double page spread in our Islington Life magazine. I've mentioned the VCS toolkit that we're distributing, and we've got a Tribune special going out tomorrow, actually. And going forward, we've got a summit that's happening on Monday. And we have a lot of different mailings that are happening over the next couple of weeks, where we'll be distributing the leaflet and other bits of information to residents. So that's kind of it in a nutshell. There is more that we need to do. So we need to develop that campaign to cover like rent, people that are struggling to pay their rent. We need to focus more on like energy, the support that we can provide with energy, because at the moment it's very much been around like money advice, financial advice, but so we need to expand that a bit further. I don't know, Louise, if you've got anything you want to add.
I was just saying, Arsenal gave a really good presentation earlier, and he was mentioning around cost of living impact around physical health, and I was talking around we're looking at a sort of future focus on mental health and cost of living and how that may have affected people. So potentially that's something that this group could help with if we do go have that as a sort of topic for future focus for the campaign. But just around the VCS and Park Toolkit, yeah, if you get in touch with me, we've got A5 leaflets which signpost not just to the council but to many organisations for help and support around cost of living. As I said, A4 posters, and then we have the as Christine's just mentioned, we have the toolkit webpage, which has all of our assets, all of our social, all the WhatsApp audio. It's got the leaflet, downloadable print and digital leaflets and posters and everything else. So I'll send round to this group. I'll send that round as a link after this session. And if there's any questions, then do let me know. But yeah, your help and support is massively important to this particular campaign, because we want to reach as many people as possible. The cost of living campaign. So it's not just the council, it's, you know, working in collaboration with partners is really important.
Thank you very much, both of you, Christine and Louise. I'll definitely open it up to questions. I just want to ask something very quickly. Navinda may well be thinking something similar. The last time we needed to communicate something incredibly quickly to as many Islington residents as possible was obviously around COVID and all of the vaccine. And one of the lessons that we learned was that the important need to diversify that message to non-English speaking communities, and then using faith leaders and that peer-to-peer support as a method to do that. Are you able to kind of say that we've learned from those lessons, and that is a consideration moving forward as to what are we doing for those non-English speaking communities, and hopefully are we using the same pathways that were successful in boosting the vaccination uptake, learning the lessons from the last crisis that we've gone through?
So I'll just jump in there quickly. So we had a meeting this morning just about that same thing, like how are we getting this message out to to people whose English is not their first language, or don't speak English, very little English at all. So and that same the same path that we took with COVID came up again, and I think that's what we'll have to do. There's one thing like translating leaflets, but I think there's obviously we need to be working with our community partners to actually translate that information and relay it to those trusted people in the community to do it. I think Louise, you worked more on COVID than I did, so you'll know more about it.
Yeah, I mean, and Kevin actually, who's on the call, was very much involved and leading on these. We had weekly phone calls, which included Jonathan O'Sullivan, who was giving health updates on a weekly basis. Some on this Zoom session, I think, actually attended those sessions, and they were attended by a group of influencers, I would say, who were then able to take that message out to their communities, and it worked really, really well. So we'll be looking at the same model, and yes, you're absolutely right. We have learned through COVID about how to communicate and get out to some of the harder to reach groups, or some of our kind of key groups that we change our models from more traditional kind of routes to market. So yeah, I mean, Christine was in the meeting and I've been in this one, so we'll catch up afterwards, and when we know more, we'll share it with you. It's a good point.
Thank you for Charlton for flagging that up, because I was going to say that too. So we've been distributing those public health leaflets around translated materials for COVID vaccine, so that there's top 8 languages that, we looked at the data in the borough. So if you want those, but primarily Spanish, Urdu, Arabic, Polish, Bengali, Tigrinya, Arabic. So we've got quite, so I think those have worked really well, and our community groups have been asking us for those leaflets so that they can at least signpost people.
Could you share that data with us? That'd be great.
Yes, it came from public health, but it was
okay.
But I can give you the top. Yeah, I'll send it on to you. Yeah,
thank you.
And I had a question about the campaign around the rent and energy advice, and I understand the energy advice, but what's the campaign around rent?
So it's still, so basically we want to avoid people falling into rent arrears, so it's giving them the right advice. So I think the 822 number is probably not the right place to direct people if they have that specific kind of like problem. So I mean, we've obviously got our housing team So we just need to think about what that message is to people, because obviously, you know, if you don't pay your rent, you lose your home. So it's just making sure that that the message is slightly different for them, and that our approach to dealing with the problems that they might be facing will be a bit different.
Thank you.
Any other questions for Louise or Christine on anything? Anyone? Kevin?
It was just on the leaflets and posters. A while ago, VI asked people to register with the council if they wanted leaflets and posters. I'm not sure whether they've gone out yet, and also whether they're available electronically, so we can lots of organisations work with people online, so it'd be good to be able to attach them to emails and things.
Now, they did go out on Monday, so anyone that requested them did go out Monday. However, just to make you aware, we were made aware afterwards that the Age UK number was wrong. So I sent out an email just to say, can you put a sticker over it if you need to send them out urgently this week, or we're going to send them out again early next week. So you'll be receiving your correct version. If you want any more, or anyone on this, anyone wants any materials, then do email me and let me know. We're sending out a mailing early next week.
So Kevin, did you receive that email? Because that has got a link to the online, because there's a digital version of the leaflet as well. So did you receive that?
No.
Oh, right. Okay. So we'll check that.
Right,
and yeah, if anybody on the call was expecting this and asked for it and didn't get it, please let us know.
Could you send them directly to Charlton and to myself, because we can distribute them across our VI News, and it goes out to about 600 listed people. Thank you.
Any more questions? If not, we are in very, very good time. And so I'd like to open the floor for anybody who has any particular events, updates, notices, anything at all that you're dying to express to the fellow network members of this group. The floor is yours.
I'd like to come in there if I can, Charlton. Thank you. My name's Cliff, and I'm the Young Islington Development Officer at Voluntary Action Islington. I too have been enrolled since the summer, and my role is particularly to explore the Young Islington youth work offer with small grassroots organisations in the borough who are not accessing the current Young Islington networks. It's a really essential piece of work or a component in the jigsaw puzzle of the offer which is being made in Islington at the moment. They really are keen to be in contact with small groups, grassroots organisations that are underrepresented at the network. So that would include, for example, girls, LGBTQ+, from the Somali, Turkish and Bangladeshi community, disabilities, etc. So I'm here really to give a shout out, and if you are in contact with any of these organisations, or you yourself are an organisation or can think of any organisations that I should be contacting, please feel free to contact me. I'll put my contact details in the chat. And if you have any questions, you can either contact me or raise them here. I feel like Louise had something to say. No, okay. I misread your body language there. So I'll put my contact details in the chat. I'll also put a little bit of blurb about my role, so you could have a look at that and contact me, as I said, if you've got any suggestions about organisations or individuals that I should be contacting, please feel free to do that. Thank you, Charlton.
Thank you, Cliff. Anybody else? Yes, Libby.
Hi, so I'm here from Talk for Health. We are a therapeutic talking skills. We put on therapeutic talking skills programs. We are funded by the NHS and predominantly Islington CCG. So we can have people just sign up and self-refer to our programs, or it can come through GP referrals or organisation referrals. And the way that people can get involved with us is to either attend one of our 2-hour taster sessions, where they'll learn a little bit about the Talk for Health service and what we offer, and see if it's something for them, or they can come straight on and join one of our full 4 6-day programs. So we have a few events coming up in October and November. So I'll just put some links in the group chat for upcoming tasters and programs if you have anyone that you think might benefit and you'd like to refer, and share it with your networks.
Thanks, Libby. And again, for everyone, if you do want to email me any particular content, attachments, leaflets, then do that. I'll make sure that it's on our website in the follow-up and sent round to loads of different groups. So make the most of that. Anybody else? Any updates, asks, referrals, offers, or general chit-chat? No? Well, if not, I'm not going to take your time unnecessarily. You've got 20 minutes of your day back. You are very, very welcome. Thank you very much for joining us this morning. And again, like I say, if you do have anything, you know where to contact me, and I will be probably emailing you early next week, just a reminder of everything we've discussed today with all attachments, leaflets, and anything that I think you might need. If there are no closing remarks, then let it be this. Have a wonderful day and rest of week, and we hope to see you next time.
Thanks very much.
Thank you.
Thanks.
Thank you. Thank you, everybody.
Thank you for putting it on. Thank you.
See you. You're on mute. Hello.
Hello, sorry, I'm on a strange screen. I can't copy and paste into the chat. Shall I just send it to you separately? What I was going to put in there?
Yeah.
Okay, I'll do that then. Thanks a lot, Charlton.
All right, see you.
Bye.